Community-based organizations are leading efforts to provide testing and vaccinations to communities that are hardest hit by the pandemic. This important work will take a massive team effort. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Petterly, Executive Speechwriter for AHA. In this conversation, Joy Lewis, Senior Vice President of Health Equity Strategies and Executive Director of the Institute for Diversity and Health Equity, is speaking with Esther Corpuz, CEO of Alivio Medical Center in Chicago, about how her organization is working to build capacity on the front lines to tackle the COVID-19 pandemic.
Today, I'm excited to be joined by Esther Corpuz, who has been actively leading the charge to combat the COVID-19 pandemic in communities in Chicago, Illinois, through testing, vaccinations, and education within the community. Thanks for joining me, Esther.
Thank you, Joy. I am very excited to be part of today's podcast and look forward to it.
Awesome. So let's begin with you sharing a bit about your organization's history in the Chicagoland community. I'm especially interested in how your organization has worked over the years to build and maintain trust within the community you serve. We know how important establishing trust is.
Yes, absolutely. So Alivio Medical Center was founded 32 years ago by a very visionary and determined woman, Carmen Velasquez. She saw the need in Pilsen, in the Pilsen community, which is a predominantly Mexican immigrant community. She saw the need for access to comprehensive quality health care that did not exist back in the 80s in the Pilsen community in Chicago. And so she partnered with Mercy Hospital, which unfortunately will be closing its doors. It's the oldest hospital in Chicago, so we're very upset about that. But we were founded to address the needs primarily of the undocumented immigrant community, which continues to be our mission today. And when you talk about trust, I can't think of a community or a group of community members that rely on trust to access health care. We have seen this 32 years ago, and it still exists today. With the immigration policies that we have in our country, health care continues to be an issue for immigrant and undocumented community members. At Alivio, we take a lot of pride in making sure that we recruit our staff within the community. All of our providers are bilingual, bicultural. Many of them themselves grew up in the community. We have some providers that are DACA and understand the needs of our patient population. And I have had patients tell me that they were floored that they saw one of our providers. They are undocumented, and then they see a provider who is DACA, and it blows their mind that one of their providers truly understands what they're going through because they themselves are in the same situation. So I think that trust is built on understanding their needs and trying to break down those barriers that they have to accessing healthcare. We also spend a lot of time working within the community with community-based organizations, using our promotoras en salud, our community health workers, and doing a lot of education and not asking a lot of questions, not making the registration process cumbersome, not asking for social security numbers. Anyone and everyone is welcome at Alivio, regardless of their ability to pay, their immigration status, or any other barrier that they may have.
Sounds like you really have a long track record of being attentive to these issues of diversity and inclusive practices. So a lot for others to learn from. So thanks for sharing that with us. So clearly your organization's been on the front lines to combat the COVID-19 pandemic. And so if you could share with us a bit about how your work has built capacity and increased access to COVID-19 testing on the front end, and now that we're looking at vaccinations, a little bit about your vaccine administration efforts. What lessons have you learned that you would like to share that you think might be beneficial to other community-based organizations who might be thinking about how they should partner with healthcare organizations?
So, of course, we're a year into our pandemic, and it caught, of course, the world by surprise. And at Alivio, when we realized that the pandemic was here, we, of course, immediately had to change all of our workflow, including, reducing the type of visits that we had, and we immediately pivoted to telehealth, which we were using telehealth primarily for behavioral health patients, but we and had a lot of resistance from our primary care providers to using telehealth prior to the pandemic. And it was amazing that, in less than a week, we were on a telehealth platform and shifted from in-person visits to virtual visits. That can be very challenging in communities of color for, a lot of issues in terms of, not having access to the internet, maybe not having access to a computer or technology. And with our senior patients, having a virtual visit is not what they're accustomed to, nor do they want to have a visit in that way. So it took a lot of educating our patients on the use of telehealth. Happy to say that, it took a lot of work, but a lot of our patients have adapted to it, and a lot of our patients actually like it and prefer it now, in particular with behavioral health. Our no-show rate is like non-existent anymore for behavioral health,
Wow.
which was a problem before. So, there has been some, good outcomes using telehealth, but, we also began to test patients, and we were doing at one point a couple hundred tests a day at each of our testing sites. That can be very challenging too in Chicago with cold weather. So we have had to learn how to test in frigid weather conditions, rain, snow. I have to commend my staff for being very nimble and just, facing the elements as they present themselves. But again, I think one of the things that I think is really important when you're trying to increase access to testing and vaccines is trying to make it easy for patients in terms of scheduling and in terms of, just finding those appointments, not making it too cumbersome. Scheduling online is great, but not everybody can do that with ease. So we
Right.
have different ways of trying to get patients on our schedule, through a texting platform, online scheduling, and us doing outbound outreach to them.
So you're really approaching it from all vantage points. And, it's interesting when I hear you talk about essentially your digital transformation strategy went from a multi-year plan to, in your case, being stood up in a week. And so all of those barriers, we figure out, and to your point, being nimble, we do what we must do when the moment calls for it. So I want to move us along a little bit in our conversation here to some data that we're seeing coming out of the Kaiser Family Foundation. They have this COVID-19 vaccine monitor report. And in their most recent report, we saw where only 42% of Hispanic adults said that they had already gotten the vaccine or plan to as soon as it becomes available to them, compared to 53% of white adults. And so, curious as to any key insights you might share with hospital and health system leaders about how we might work with the Hispanic community to increase their vaccine uptake.
Well, a few things come to mind. Number one, again, working with other community-based organizations is extremely important. One of the things that we did in Chicago, which also involved a lot of hospitals, was organizing ourselves with other hospital leaders, with community-based organizations, other community health centers, with the faith-based community, we have two groups that were formed as a result of COVID. One of them is the city's racial equity provider group. And this group is comprised of a group of hospitals and other community health centers and other like-minded groups that are interested in making sure that communities of color have access to testing and vaccines, and working together to try to come up with solutions to any sort of issues that involve access to getting the test or the vaccine. And I found that to be so helpful, that you're not trying to do this by yourself, by trial and error. We learn from each other. So it's a collaborative approach to making sure that the communities that are hardest hit are being addressed. And I think that is so valuable. It started out with like 5 of us on a Zoom call a year ago, and now we have no less than 200 people, and we learn from each other and we share what has worked, what's not working, and I just think that it saves you a lot of time, and we're unselfish in our work. Healthcare is very competitive, but we found that this pandemic has really helped us to work together and just do what is needed so that we can approach this in a way that is going to stretch our resources as much as we can.
So I guess one of the positive unintended consequences of the pandemic is this real collaborative approach that we're observing, and that you just described in your community. And so hopefully we can see that stick post-COVID, where the various key stakeholders in a community will come together to design for the health of that community.
Yeah, and the other group I wanted to mention, because is Illinois Unidos, which did not exist a year ago either, and is very similar to the racial equity provider group. This group is more focused specifically on the Latino community, because we found that Latinos, we have seen with our positivity rate being much higher due to, housing issues, essential workers working in factories and not being able to socially distance. So very, very specific challenges specific to the Latino immigrant undocumented community. And so Illinois Unidos, very similar to the racial equity provider group, are key stakeholders in Latino areas that come together a couple of times a week to address the issues that face specifically the Latino community.
That's great. Thanks for sharing that. So in closing, I want to ask you a little bit about vaccine distribution and the inequities that we're seeing in the rollout. So given your learnings to date through your work in the Chicago community and what you've come to know about access issues, what do you believe are the greatest opportunities, the areas of opportunity for hospital and health systems to strengthen a more equitable approach to vaccine administration efforts within their communities? So what lessons might be translatable to hospital and health system leaders?
Well, first of all, I think being very deliberate in targeting those most hard-hit communities for what we call like a vaccine blitz. And this way, what we're doing is we're partnering with a hospital system to target these very specific communities. This is a program that has come out of Mayor Lightfoot's Chicago Protect Chicago Plus, and it's targeting 15 communities. Presently, we're in the first stage of it, and getting a specific allotment of those vaccines and identifying a health partner like an Alivio or like another FQHC or a hospital to do the vaccinating, and then working with groups to lead outreach efforts. And we feel like these are very key elements in making sure that the residents in those communities with the highest positivity rates are getting vaccinated, and also ensuring that these vaccines stay within the community and not outsiders, because what we have seen, and I'm sure this is true across the country, is that oftentimes we see folks coming from outside the communities to get vaccinated, and it's kind of refers to it as the Hunger Games, just everyone just trying to frantically find a vaccine. So I think being very deliberate about it, but again, I think ease of access to appointments is very important. We're using, as I mentioned earlier, a multi-prong approach to having, appointments. Appointments must be made because we need to know how many vaccines are available that day. We don't want to waste a single dose. So we're using texting. We're not big on having folks call us because our phone lines then get overwhelmed. So we're using a method so that patients can text us and then we call them back, or doing online scheduling if possible. And then we're also, we have our own patient list of patients over 65 or patients with certain health conditions, and doing a lot of outbound calls so that we can control the appointments, being very deliberate with targeting those communities that are most hardest hit, and then ease of access of appointments, I think is very, very key.
Those are really helpful insights, Esther. I'm hearing you say don't go it alone and be very intentional in our approaches to enhance vaccine administration efforts, specifically targeting those communities that have been disproportionately impacted by the pandemic. I want to thank you for all that you do and the commitment you have to working alongside our hospital and health system leaders as we work to advance health in America. Thanks so much for being here with me today.
Thank you. It's a pleasure.